10, 20 years ago.
You would be surprised at what they wanted to do. Electronic, whatever, it's a cigarette.
That are in the later stage.
Always lively. Okay, so the next presenter we have is Brandi Roberts. She works at the Arkansas Department of Health. Thank you. Her presentation will describe the epidemiology of syphilis, which Deidre was talking about, and discuss the CDC recommended treatment regimens. And she is a graduate of the University of Florida and also UAMS here in Little Rock, where she received her master's, and her thesis focused on HIV prevention for African American women ages 50 and older. Let's welcome Brandi.
All right, they put me behind Deidre. Lord have mercy. Lord have mercy. So anyway, as she explained, my name is Brandi Roberts, and I do work at the health department. So I know we got a bad rep right now, but I do work at the health department. I am the STD prevention program manager, so I work alongside of Courtney Hampton. Everybody know Courtney as our HIV program manager. I only been in this position for about 4 months. So my primary duty as the prevention program manager is to make sure we get money in the state of Arkansas so that we can, fund our STD prevention programs at the local health unit. So my other job is to also supervise our DIS staff, which I don't know if people are familiar with our DIS staff, but they are our disease intervention specialists. So if you test positive for HIV, syphilis, they're coming out to get you. If you don't answer your phone, they're going to come get you. So I am the supervisor over the ones that actually do those partner services to make sure that, you're getting tested and you're getting treated for those particular STDs. So today I'm going to just briefly talk about syphilis. Deidre kind of went over the time, so I'm going to try to make this quick and short, and I'm a little bit sick, so y'all please excuse me. So I'm going to talk about syphilis and other STDs in Arkansas. CDC recommended treatment options, and also some public health measures for the prevention of syphilis. Okay, so just to look at our 2012 records, which I noticed yesterday, they are not on the health department website, but I will give those to you today. So last year in 2012, look at our chlamydia. We had 16,632 cases of chlamydia. Gonorrhea, 4,313 cases of gonorrhea. And then syphilis, 325 cases of syphilis. That's what we had in Arkansas in 2012, according to our surveillance data. So what we're primarily going to focus on is our early syphilis. So I did the results for the last 5 years. So you look at 2008, 2009, 10, 11, 12, see it slightly went up, and then you see it's coming down. And like I say, in 2012, we had 325 cases of early syphilis. So we look at it in comparison to gender. Males have more than females. And, when we look back at those other STDs, gonorrhea and chlamydia, you see that females, have the highest rate of cases. But in syphilis, we tend to have males, kind of have the most cases in regards to early syphilis. Then we want to look at breakdown of age. As you can see, 20 through 29 have our highest number of cases in Arkansas. And like I said, we're looking at 2012. Our 2013 data isn't out yet. But we see that this syphilis, they tend to affect our younger population, 20 to 29 years old. And then we look at race and ethnicity. As we can see, Black, has the majority of the cases. So looking at 325 cases that we had in Arkansas, look how many we have that affected our Black race. Okay, so what is syphilis? Everybody pretty much know that it's a sexually transmitted infection, and it is caused by this bacteria called Treponema pallidum. So syphilis, it can cause long-term complications and or death if it is not adequately treated. CDC estimates that there's about 55,000 people in the United States annually that get new syphilis infections. So how is it transmitted? It's only transmitted 2 ways, either from having sex or you can get it vertically, which means that an infected mother can pass it along to her baby if she's not treated. So So transmission of syphilis, like I say, vaginally, anally, oral sex, and through the direct contact of those syphilitic sores, also known as the chancre. So syphilis can cause poor outcomes in pregnancy, including, miscarriages, premature births and stillbirths, or death of newborn death of newborn babies if the infected mother is not treated in time. In 2012, we only had one congenital syphilis case according to our 2000 surveillance records. So what we're gonna go back to the last one. Okay, so what we're going to talk about is the different stages of syphilis. So what we have is our primary stage, our secondary stage, and our latent and late stages. So basically, the incubation period, is the time between the time of infection and the start of symptom. So say, for instance, you have sex with somebody today. It's going to take up to an average of 21 days for those symptoms to start showing up. It can average between 10 and 90 days, but, roughly it's about around 21 days or 3 weeks before those symptoms are going to start showing up. Syphilis is often misdiagnosed and can mimic other diseases. So oftentimes when you go into a doctor and they see these sores, they're thinking it's going to be genital herpes, they think it's going to be chancroids, and they're going to think it's anything else. So it's going to be up to, you to understand and, be able to identify those symptoms that cause syphilis. I didn't go into putting the nasty, horrible pictures. You can go look them up because I know it's time for lunch, and I did public health because I don't like dealing with patients, so I did not put those pictures up. So you can just go ahead and Google syphilis, and you'll be able to see those pictures of those different, the chancres and the rash and so forth. So basically, the first stage that you get into is your primary stage. Your primary stage of syphilis, that's going to be the first stage. So like I say, once you have sex, them 21 days, you're going to get into your primary stage. That's when you're going to get a sore. It's often they often don't catch it in the primary stage, especially in our MSM and our women, because those sores tend to be, in the anal wall, so you can't see it, or it's in the vaginal wall, so you can't see it. So then you're gonna go. So even if you don't get treatment, you're gonna automatically go into the secondary stage. So, people think, oh, it don't went away. No, it ain't went away. That's just how syphilis works. That sore is going to go away, and you're going to go automatically into your second stage. Your secondary stage is the most often stage that we see here in our clinics. You're going to have rashes on your hands and on the bottom of your feet, and sometimes it's all over your body. Have a lot of people, go to the doctor, they see this rash, oh, they finna give you some cream because they don't know that's syphilis, So, we have, it's kind of up to our DIS to, determine that, because a lot of doctors don't know, they're not used to seeing that rash, so they're going to give you some cream and send you on your way. So, you have the rash, it's going to eventually go away as well. And then what we get into, what we call is the latent stage, what I like to call the hidden stage. So at this point, you still have the syphilis in your body. If you're not treated, you still have it in your body. So the only way that you're going to be able to detect syphilis is if you go get tested. You can go to the next part. Okay, so basically, this is how syphilis is diagnosed. In our clinics, we use the RPR test, which is triple test, and basically this is where we have our titers. It's a fourfold titer where it's going to determine how much of the syphilis is in your body. So you're going to have either a 1 to 4, 1 to 16, or so forth. So in our clinics, when you test positive for syphilis, you're going to get that RPR titer. And then what we have is known as a confirmatory test. The reason the confirmatory test is very important is because sometimes you can have that titer, but it's a lot of things that can trigger that RPR. So what this next test, the confirmatory test, it looks for the actual syphilis virus. So when you get that RPR, this is going to come back and tell you, oh, this person does have, syphilis. It's going to look for that bacterium that we spoke about in the beginning to make sure that you actually have syphilis, so we can go ahead and get you adequately treated. How am I doing on time? Okay, so basically, these are the 2 CDC recommended treatments for syphilis. So I know that name a little long. I should have just put penicillin. You're going to get a shot of penicillin, for your syphilis. In your primary and your secondary stage, you're going to get 1 shot and 1 shot of your penicillin. If you get into over a year of having an infection, it's up to our DIS to try to determine how long you've had the infection. So if it's over a year, you're going to get 3 shots of penicillin. If you're allergic to penicillin, we're going to give you some doxycycline or some sorry, I told y'all I'm sick. basically some different kind of antibiotics. So go ahead and treat your syphilis, but you do have to make sure that you get treated for syphilis, or otherwise syphilis can go into neurosyphilis, which can go into your brain, affect your nervous system, and you can eventually end up dying from syphilis. Okay, so who should be tested? Pregnant women. As I say, you do have congenital syphilis cases. So if an infected mother has a baby, she has syphilis, that baby can get neurosyphilis. I didn't put those pictures up here as well, but you can Google that, congenital syphilis, and you can see how the babies look when they have syphilis. So that's why, it's very important that women, they go get their prenatal, care and get tested for HIV and syphilis, because it's very important, because they can pass that syphilis on to their babies. Our at-risk populations, MSM populations, drug users, make sure, our black, like we looked at before, our black population, making sure that you're going to get tested for HIV and syphilis. So when you go to the doctor, when they test you for the gonorrhea and chlamydia, let them go ahead and take your blood so they can go ahead and do syphilis and HIV as well. And there are also partners who have partners that have tested positive for syphilis. So, you sleep with somebody, they come back and say, oh, I got syphilis, you need to go on up to the health department to get tested. Point blank period, so they can go ahead and get you treated. I know I talk fast, I'm sorry. Okay, so for preventive measures, I was going to put abstinence up there, but, we could talk about abstinence all day, But, main one, condoms and testing and treatment. Condoms, like I said, there is a chancre, and, you can't get syphilis from that chancre, that sore. So sometimes, the condoms may not protect, from, because, when you get in contact with that sore, that's how you're going to get syphilis. So you just have to be careful with using condoms as well, as far as, trying to prevent yourself from, having condoms. But the main thing is, getting tested and also getting treated for syphilis. Okay, thank you. Do you have any questions?
Does it cause men to be sterile?
Syphilis? I have not heard of it causing men to be sterile, but, it's a possibility, but I have not heard of any research on it.
You did.
Thank you.
Has the health department seen any resistant syphilis that's been talked about for a while because of so much treatment with penicillin and other antibiotics?
Well, that's just going to be like with any antibiotics, where you're going to have some type of resistance. The main thing that we're really having is our gonorrhea resistance, but, that's just with any antibiotics. But if you're taking too much of it, you're going to have resistance to it. So, like I say, the main focus now is our gonorrhea resistance. So,
Just to follow up on that, we have not yet seen it. Brandy's right, it may happen in the future, but as of now, we're still okay.
yeah.
I know we're seeing with gonorrhea.
Right.
It's not with syphilis. Okay.
I wanted to know that 16,000, was that everybody, or physicians or healthcare providers, would have to report that to the health department, or is that just the health department?
No, that's a good question. Actually, all the lab providers and physicians are required to report their lab results to the health department. So any positive lab that we get, that's where those results come from. So that's from everybody, not just the health department.
That last part where you say have to be careful, even with condoms, with syphilis, if the sore is on the scrotum or the balls, even if you got a condom on or below the woman's vagina, even if you got a condom on, you can still get it
Right.
from skin to skin contact.
Right.
My question is very similar to what Brenda asked about the surveillance data. So now I know that physicians do report, not only the health department.
Yes, they are required to report.
Okay, so in terms, when you started out your presentation, you made a point to say, if you don't come in, we will come out to find you.
Right.
In terms of those patients and the numbers coming from private physicians, how do you interface or connect with private patients?
Okay, so let me tell you how this works. So basically, when you go to a doctor, say for instance you go to your private doctor, so when they send that lab in, it's going to be automatically reported to the health department. So we're going to get what we call the field record. So that field record is going to show those positive results. So what our DIS do, they call your doctor and they say, well, has such and such been treated? no, if you haven't been treated, we're going to try to call you and make sure you come in and get treated. So every lab test that for private providers, the health department, it comes to us because what we have to do with our reportable diseases, gonorrhea, chlamydia, HIV, and syphilis, we have to make sure that those patients have been treated. And if they not have been treated, we have to make sure that we, have them come into the health department so they get treated. So that goes with private providers as well, if they are reporting, information to the health department, which they are required to do. Okay. Oh, I'm sorry. Go ahead.
Oh, well, my question is more so on policy. I know there's strong policy, well, not only policies, laws in place in Arkansas about transmitting HIV. Are there any laws in place related to transmitting syphilis to a person without telling?
No, there's not. Go ahead.
Are there any consequences if you find someone and they are potentially have syphilis and they refuse to be tested?
As of right now, we don't. We used to have that back in the day, which is something that we're looking at, but as of right now, we don't. I mean, if you don't get treated, that's basically on you. I mean, we can tell you what to do. We can tell you that can kill you, but if you don't want to get treated, we're going to try to get you treated, all we can, but there's no specific consequences on it if you don't want to get treated for it. Go ahead in the back. That's a very good question. So that's what we have those two different tests for. So the RPR is basically what we use. Well, the other test, which is the TPPA, which I showed, that's going to always come up positive. So that's always going to show that you have syphilis in your blood. What we use to determine if you've been reinfected is the RPR. So say for instance you have syphilis, you get treated. Okay, you're at a 1 to 32. It's going to go down to like a 1 to 4, and I'm just using it as an example. So say for instance you go sleep with somebody else, that RPR is going to go back up to 1 to 32. So when we look at that RPR, that's going to show that you've been reinfected with syphilis and that you need to be retreated. So that's what we look at. Go ahead. No, you can't. You can't. It's not technically in your blood, but that test is still going to show up positive. So that confirmatory test saying that you've had syphilis before is going to still show up. So you still can't donate blood or anything like that because that syphilis test is still going, that confirmatory test anyway is still going to show up positive for syphilis.
What were those 4 main STDs, I guess, that you said?
The 4 reportable ones, you got gonorrhea, chlamydia, HIV, and syphilis.
Okay.
And those are not the only ones. That's just the ones that are reported to the health department that we follow up on.
Okay, so are those the ones that are deadly?
I wouldn't say deadly per se. Of course, you got HIV and you got syphilis, and like I say, if syphilis goes untreated, it can kill you. But with gonorrhea and chlamydia, if those are not treated, you have the risk of getting PID, which is pelvic inflammatory disease, and other issues that women can have, infertility and things of that sort. So
syphilis is another one like HIV that really should be some guidelines put in place for it. Sounds like. If you having sex with somebody else and they don't know that you have syphilis, that's just like having sex with somebody you don't know they have AIDS.
But that's just like any other STD. That's going to be up to you to go get them tested and use use protection.
But if you don't know, that's just like sleeping with somebody that you don't know has HIV.
Right.
Or AIDS.
But yeah, right. But as of now, syphilis is treatable. So, as of right now, we don't have any, where they have to sign any laws or anything as far as syphilis, just HIV, where they have to sign those Arkansas laws saying that you have to notify your partner and so forth. So.
When you're talking about chlamydia and syphilis and gonorrhea, are any of those diseases strictly females, strictly males, or can a male get chlamydia?
Right. It don't discriminate. It can go male, female, all of them. It's just that, chlamydia tends to be, higher in our female population, because, chlamydia is very asymptomatic, meaning that you really don't have a lot of symptoms, So, yeah, it don't discriminate at all. Anybody can get any. If you sleep with somebody who got chlamydia, you can get it, male, female. All right.
I know that women, if we have a better excuse, we have to go in and get our annual done.
Right.
But you said a blood test confirms AIDS and syphilis, so does that confirm the annual? Is that confirm like syphilis or AIDS, or does that have to be a specific blood test? Like we draw your blood for a test?
Yeah, I mean, when you go to your annual exam, you can ask them when they draw your blood to test you for HIV and syphilis. Is that what you're asking?
Yeah.
Okay, yeah, you can specifically ask for that, because when I go to the doctor, I tell them to test me for all of them. I want, chlamydia, gonorrhea, HIV, and syphilis. So that blood test, if you tell them, they're going to run that RPR test and, the confirmatory test to see if you have syphilis or, HIV or any of the STDs.
But the key is you have to ask them, right?
You have to ask, they don't have to ask. They don't
Yeah, some doctors, I don't have to ask my doctor, and most doctors, they're supposed to be doing it, but I ask when I go into the doctor. That's just something that you have to be knowledgeable enough to know, to go in there and ask for, because some of them, they won't do it. They'll just, whatever. So, you want to ask for it just to make sure that they're testing you for it, because it's covered under your health insurance as well. It's a preventive service, so.
Just for clarification purposes, is the female the carrier of chlamydia?
What you mean, the carrier?
Source of chlamydia?
Not necessarily.
Not necessarily, so like
Anybody can be the source.
it's like a stereotype out there that females are carriers of chlamydia.
I wouldn't necessarily say they're the carriers. It's just that chlamydia is so asymptomatic, you don't have symptoms. So, if you don't know you have it and you sleeping with people, of course you're going to keep passing it along. That's why it just tends to be a lot more cases of chlamydia just because you don't have any symptoms. You have people going around for years with chlamydia and don't know until, it goes into like pelvic inflammatory disease and so forth. But yeah, you just think it's a normal discharge and you won't know that you have it, so. Oh.
The treatment guidelines, you mentioned 3 doses of penicillin.
Mm-hmm.
Is it the same for all stages? According to the health.
No. It's only you only get 3 doses when we know that if we don't know the duration, you'll get 3 doses, and also if you have syphilis for over a year, you'll get 3 doses of the penicillin.
But for primary.
For primary and secondary, you're going to get 1 dose of penicillin. Right. All right. Thank you. Thank you so much.
Good
Thank you. I know.
We're going to also present Brandi with her certificate of appreciation from Future Builders. And we have an announcement. It's about to be break time, but I want to give someone the opportunity to make an announcement about some services that we have available here today.
Hi, I'm Sybil Ward with Jefferson Comprehensive Care Systems, and we are here partnering with Future Builders and the Arkansas Department of Health to provide free HIV testing. There are no needles. It's an oral swab. You can get your results in 20 minutes today during the break, and it is 99.5% accurate. It's a second-generation test. You can know today your status. And there are arrows in the hall. We have 3 rooms, and everybody that has a shirt on like this one is most of us. I'm looking at some people, but yeah, we're all going to be testing all right here, and so you'll see us running in now. But please come and get your free HIV test now during the break before we have lunch and everything else. All right, thank you. It's free. Mm-hmm.